Excellent. Okay. So I have the distinct pleasure of introducing our speaker today. We're talking about basically an interactive web-based planning tool based on the Designing for Dissemination of Sustainability, D4DS sort of model. And so Dr. Maura Kepper is talking to us today. She's an assistant professor at Washington University in St. Louis in the Brown School and is a member of the Prevention Research Center there. And her research really focuses on implementation science and the intersection with behavioral medicine and informatics, and focusing on addressing community level barriers for reducing health disparities and obesity, cardiovascular and health and cancer. And I think it's going to be a pretty interesting overview of this model and this web-based planning tool. So with that, I'll go ahead and pass it off to her. And if there's anything else she wants to introduce herself with, that would be great. And it sounds like it's pretty interactive as well, what she has planned. So feel free to kind of speak up and have questions if you have them.
Awesome. You guys are seeing my screen okay? Great.
Yeah, looks great.
Okay. Yeah, thank you so much for the introduction. This is definitely just a small part of what I do, but have taken a deep dive into this area of designing for dissemination and sustainability. So I'm going to give you an overview of what that is today, because it's a relatively new area in implementation science. And then I'm going to introduce a tool that we've developed that is available to all of you. And I'll show you what it looks like. So, okay, so what is designing for dissemination and sustainability? I'm going to refer to it as D4DS throughout the talk. So when you hear that, you know what I'm talking about. But the idea is really pretty simple. It's beginning with the end in mind. So we are thinking about from the beginning of our project, how we're going to disseminate, implement, and sustain our work in the real world. So in other words, another way to think about that, if you guys are familiar with the 17-year odyssey that we like to talk about in implementation science, it's not waiting until we get all the way till the end of that odyssey to think about how we're going to translate something into practice and generate impact. Rather, from the conceptualization of your research or your project, you've already started thinking about how you're going to disseminate, implement, and sustain it. The idea is that as we think about this from the beginning and throughout our process of research or through that odyssey, it allows us kind of ways to adjust our research or adapt our research to generate and maximize impact. The second idea here is that we have to ensure that our product, and I'm going to define what a product is in just a bit, the product that we're developing fits the context in which we are going to be implementing it, and that it's valued by those who are going to use it and will benefit from it. The other key parts of this are that we're planning for active dissemination and we're generating products that can be sustained and have plans for sustainability ahead of time. So those are the four core components of designing for dissemination and sustainability. I know you guys have probably seen these terms and know these terms, but I like to do some level setting so we're talking about them in the same way through the talk. So when we're thinking about or talking about dissemination, we're defining that as an approach of spreading evidence-based products and interventions to the right people, that's our intended audience, using really planned channels and planned strategies. So we're thinking about the way we're disseminating, what method we're using. Are we doing an article? Are we doing an infographic? And the way we're sharing it. Are we sharing it on social media or via an academic journal or a webinar? There are a lot of different ways you can share information. And so really being intentional about those strategies and channels to make sure they meet and reach our intended audience. Sustainability, we're thinking about the ability to maintain the intervention and its benefits over time. And then you're going to hear me talk a little bit about health equity and how we integrated health equity and think about health equity in this D4DS process. And so we're really thinking about that as a value, a process, and an outcome. And that's having a fair and just opportunity to be as healthy as possible. I want to just like acknowledge right out of the gate that D4DS does not address all the obstacles that historically marginalized populations face. We're not trying to, we can't address poverty, discrimination, all of those things. Rather, we're trying to integrate equity into the D4DS process to make sure that we can promote health equity and maximize health equity as much as possible. So it's really a process in this sense. D4DS is a partner engaged process. So it prioritizes the needs and perspectives of potential users, recipients, decision makers at every stage of our research. And through this process, it's important to consider a diverse range of perspectives. So we're not simply thinking about just the recipient or the implementer, but really we have to think about other people who may influence our product, who may influence the sustainability of our product, really. And that might not be someone who's a supporter of it. It may also be someone who may sabotage the use of our product. And we sometimes forget to think about those individuals. So this framework you're seeing here is called the 7 Ps framework for stakeholder engagement in outcomes and effectiveness research. I think this offers a really nice starting point for considering patients, the public, providers, purchasers, payers, policymakers, product makers, and I think they call it principal investigators or researchers. But really just to start thinking about that diverse range of individuals who may impact the dissemination and sustainability of your product. So there's a wide range of levels of how you would engage these people, depending on the needs of your project, what is feasible with your project. You might choose to engage partners in multiple ways, differing levels, to support design, dissemination, and sustainment. We are really encouraging through this tool, and I'm going to show you what that looks like. We're encouraging moving away from just a one-time interaction, more of that contractual agreement. And we really want to think about engaging these people in a more collegial and collaborative way over time. So it's meant to, this D4DS process is meant to be iterative. It's meant to be collaborative. There's kind of parts of the tool that promote shared decision-making, power sharing. And so we're really trying to move out of the one-off consultation. There's a wide range of methodologies you could use to engage partners. So I'm sure you guys know, community-based participatory research, community-engaged research, participatory design, participatory action. And some of those methodologies are integrated within the D4DS process. So human-centered design, for example, is a methodology we use in one step of the process. So you'll see a number of those methodologies here. So this is the fit to context framework. It is the main framework for D4DS, and you can see it in the most recent implementation science book. I wish I had it here for you, but I don't. And it really has 4 phases: conceptualization, design, dissemination, and impact. And really the focus of this is to support research product adoption, sustainment, and equitable health impact. So in the conceptualization phase of this, the objectives are to establish partnerships, to identify relevant evidence, and assess the context in order to establish need and demand for your innovation. And then as you also have to understand the capacity for change within that context or setting. So that's your conceptualization or design phase, or your conceptualization phase. In your design phase, you're really moving into co-designing your product or your innovation and your dissemination and sustainability plan. The idea here is that you can generate a product that's feasible to implement, that's acceptable to your audience, that's useful and equitable. and that you have dissemination plans and sustainability plans that align with your context and your users. All of this happens before moving into a dissemination phase where you're actively disseminating your product to increase awareness, intention to adopt it, and sustain it, as well as creating equitable access. The impact phase really examines your research product adoption, implementation, sustainment, and then broader impact on health and health equity. You see here, I have a red box around those first two phases of this framework. That's because that's what the tool I'm about to present focuses on. The tool helps you with these two conceptualization and design phases before you move into active dissemination and assessing impact. So I told you I was going to define product because I've said product, I've said innovation, I've said, I don't know, probably other terms. In the tool, we use the term product. And so what does that mean? Really, it's anything you learn or create from doing research. So this may be an intervention. It may be an evidence-based practice, maybe a technology or a digital health tool. It could just be a research finding or evidence, policy. It could be a method. It's really anything that you generate. And it is your product, for the purposes of this tool, is the thing that your team is trying to disseminate and sustain. So D4DS, and this is just a few ways I think D4DS could help you. It could help you by developing an intervention that can be applied widely, particularly in underserved communities. It could increase the relevance of research to practitioners as you engage them in this process. It could increase knowledge and uptake of evidence-based practices, programs, policies, and strategies, and hopefully achieve lasting impact in health outcomes and health equity. I put this here, but I'd really love to hear from you guys. I'm going to pause for just a minute, how you might think D4DS would benefit your work. And what are some challenges you've faced in designing interventions for dissemination? You can either come off mute or you could put thoughts in the chat. Either one works for me.
I just had a quick thought. I think this is fascinating. And, you know, in some ways, I wish I was aware of this like 4 or 5 years ago when we were writing a grant. But, you know, we got a D&I grant funded, and we specifically wrote in plans for dissemination in the last year. But this does make me think that one of the challenges of extending that dissemination work beyond the life of the project is something I certainly haven't thought about before. And I was just curious if you'd had any thoughts about that, because the dissemination certainly shouldn't end ideally with the end of the project, but I can honestly say I hadn't thought about ways to extend it beyond that. So I was just curious about your thoughts on that.
Yeah, it's a great question. Every grant proposal now is requiring the dissemination plan. So actually in the tool, we have some kind of examples of those to help you with if you're like really putting in a grant application. But I think you're right. It really should go beyond just the project itself. And that's really where the sustainability planning gets you thinking pretty critically about what are some areas that you could build capacity to support the dissemination and sustainability of your product long term. So that could be building new partnerships, or just even thinking about your internal strategic communication. It has you thinking about a number of different, I'm blanking on, and I'm going to present it in a bit, 8 different domains that were put together as part of the PSAT program sustainability assessment tool that Doug Luke developed at WashU. So I think that would really get you thinking about how to go beyond just your actual research project.
Mara, one of the things that we have struggled with, so I'll give the example. We have an intervention we designed, a long time ago, 15 years ago, maybe something like that. And thinking about this as a kind of a packaged intervention, we developed lots of partnerships to sustain it in the short to medium term, but thinking about as interest in that particular intervention changes over time, as websites need to be kept up to date. And, when we first developed the website, now it really needs to change a lot. We made it very interactive, and how our academic institutions just aren't set up to be like the businesses that run intervention delivery. And there are a few instances where I see people doing that. But sometimes you have to like start your own enterprise outside of academia, and that maybe that's not something you want to do. So that's one thing that we've really struggled with.
Yeah. I don't have, I don't have the answer because I
Yeah.
also struggle with this as I have my own digital intervention that I'm trying to kind of piecemeal together with academic money. I think the one thing that D4DS draws on is kind of business and market thinking from the start. So you mentioned the interest, which is a demand, right? You have to have the demand for your product out of the gate. If you lose demand, like you said, if you lose interest, you're going to have a really hard time sustaining. So that's one thing we do in the tool is we get you thinking from the start, what is the value of your product from the perspective of your end user? What's the value proposition of your product? Because if you lose the demand or the push-pull, then yeah, you're right. It's really challenging then to kind of keep it going. But beyond that, the financial part of maintaining the intervention is just really challenging on grant money. And I don't think our structures are always set up for that.
Yeah, and the other thing I'll add to the other side is if you decide you want to give it away for free, there are institutional barriers to trying to make things open access and your institution wanting you to not do that. So the flip side is if you go that way, that can also be challenging.
Yeah. Okay, I'm seeing in the chat, which I often see dissemination interpreted as effectively spreading the word to all who might benefit using appropriate context-sensitive channels. That seems to me to be relatively easy compared to actually having the product adopted and implemented with fidelity and reliability so that the hoped impact actually is achieved for all who might benefit. How are you thinking about this? Yeah. So this, I think, gets to the kind of tricky world of dissemination research where our terminology of dissemination versus scale up versus implementation or whatever it is gets pretty muddy. I will say in the tool, we're really thinking about dissemination as sharing about your product. So sharing information about your product, not necessarily how you scale it and implement it in multiple contexts. Although we do a lot of thinking about from the gate, how do you design a product that fits your context? So hopefully it does scale more easily. I'm trying to think about how I would answer your question. I don't think I have the best answer. I think it's part of the challenge of our field. And I know Anna Bauman published a really nice paper, a review on dissemination terminology. And I think we don't have necessarily the best understanding in the field about the differences in those and which methods and strategies are needed for dissemination versus scale up. And I think those are definitely different things.
Yeah, I would say I don't know if I have a good answer for that either. I was going to raise another challenge unless you were going to move on, which I think is we do a lot of multi-component interventions, which combine multiple different products or interventions. Maybe there's a term that encompasses the whole multi-component intervention, which I see as like two specific problems. One is we don't always know what the most effective piece or component is of that intervention by the way in which it's been implemented and kind of studied. And two, in explaining that to others, whether it's this early knowledge piece of the dissemination or the later piece about how people would be adopting it or paying for it, et cetera. Like what is the product specifically, if really what we're studying is this bucket of things. And so I'll kind of offer that as a challenge that I know we face when thinking about what the interventions are and how they would scale up.
Yes, since I asked that question, if I can get myself on camera here, I think it's actually a critical distinction, and I don't see it clearly delineated in most of what I encounter among trainees or even professors. And I'll give you an example. So the Institute for Healthcare Improvement, where I do some work, has something called the 4Ms for elders. Age-friendly hospital. You're supposed to have mobility, mentation, medications, and what matters to you. And very often you'll see a presentation where somebody from the IHI says, we have touched, I don't know how many hundreds of thousands or millions of old people in hospitals around the country and the world. And it seems to me that that's nice, except I don't know what that means. And so when we say design for dissemination and sustainability, there's an implied bargain there that we'll tell you, we will have designed it so it's implementable, and we'll tell you what you need to do to get started. And by the way, we hope you'll also have the skill set to do that, which is rarely, unfortunately, the case. So some use cases like the Diabetes Prevention Program, which very widely disseminated and implemented, not that well evaluated at scale, but nonetheless, it was pretty clear if you do all these things and can check them off, you've implemented it. So that's a little bit better than saying, how many times you consulted the website.
Yeah, I fully hear this. It's something we struggled with in the development of the tool, because we don't help with implementation in this tool. So we're setting you up. We're trying to set up, basically helping you conceptualize a product that hopefully will improve your implementation and scale and sustainability, but we're not really moving into the active part of that.
Well, it's worth thinking about that. I think in the dissemination plan itself, for example, I need to buy a new tool for my raised bed in my garden. And I went online, and there's all kinds of channels that tell me I should get this implement that was designed and forged by a Korean master craftsman, and it only cost $21.95. And then I can easily go directly to a video that shows me exactly how and when to use it and what it won't and will do. That's obviously a lot more simple than management of schizophrenia, but it's nonetheless the kind of thing that people probably ought to think of in advance. It's always an aftermarket thing with most products. The original designer has some help, but it's the aftermarket on YouTube that actually figures out how to use it. So I'm just kind of campaigning hard for thinking about this all the way through to the swinging the bat through, basically.
Yeah, no, I appreciate it. No, part of this, and I should have disclaimed from the start, we just launched this tool in December. So this is a new tool. So part of me presenting is not only telling you what D40S is and showing you the tool, but we're also, constantly going to be improving the tool and trying to learn from people like you and other users. So I appreciate any of these comments. Okay, I'll keep us moving. Okay. So, all right. So who is this for? We really designed the tool for any team conducting health-related research. So that could include academics and practitioners. And there's a component of including your community partners in this process. So I'll show you what that looks like. Ideally, you're starting this process from the beginning phase of your project, right? You're in the conceptualization design part of your project. However, You could come into this tool after your project is you've already kind of designed and tested your product and you're really just trying to share information about it. You're trying to create a dissemination plan. You could just come into the tool and create that dissemination plan at that point. So we don't require that you go through the entire process. You could come in and do just one part of it if you wanted. Because we're preaching about participatory design. Of course, we developed this using a user-centered design process. So we engaged 20 end users, both academics and practitioners, to help us develop this tool. We really did this using an iterative kind of mixed methods approach where we went through discovery, really understanding what did users want, what kind of features might they want in a tool like this, how this tool would benefit their research. Then we kind of explored which of those features are most important, developed wireframes with them, then we developed a prototype tool and tested it for usability. The version you're seeing today is the tool that was refined based on the usability testing. And so this is our version 1.0, but like I said, we're going to be constantly learning and changing things. This is the homepage. So if you go to d4dsplanner.com, this is where you're going to see. It has two main components, the Education Hub and the Action Planner. The Education Hub has all types of resources about designing for dissemination and sustainability. This is publicly available to anybody. So you do not need a login to get to this tool or this part of the tool. You could just go explore resources. You can filter for different types of resources. So you could look for only things focused on dissemination. You can look for case examples, literature, methods. We have resources specifically focused on equity, which we call Q to equity in the tool. So you can filter however you want to find specific things. This is what the Action Planner looks like. This is really the main component of the tool. This is the interactive platform that allows you to go through this D4DS approach for your project. So you have to log in to this part of the tool to utilize the interactive activities. Once you do that, you actually set up a project in the tool. So it asks you some specific things about the project you're working on. What's the problem you're trying to solve? What is your product you're trying to disseminate and sustain? General information about your budget, those types of things. You then invite your team to collaborate with you in this tool. So this may just be your research team, or you could choose to invite community partners at this step as well. And they're going to interact with you in this specific project through the D4DS Action Plan. Some kind of key features of the tool that help you. We have kind of a guided tour right when you get into the tool. So it'll show you what the different features of the tool are. Each page of the tool has a video to orient you to what you're going to do in that action item, is what we call the steps in the tool. Each action item has an interactive activity that you would work through as a team. And I believe there are 7 of those. And so what it does is as you complete steps, it tracks your progress as you go through them. So you can see on the right picture here, it says either in progress, not started, or it would say complete if your team has completed an activity. And at each step, you also have a chat function. So you could work asynchronously and just use the chat where your team is chatting about the action item in the tool. We tried to design this so that you could either pull it up as a team in a meeting and do it together, or you may choose to work asynchronously. You can actually have a team lead assign people tasks to do in the tool, and then you can chat with your team in the tool. This is not like I'm going to sit down and use this tool and do it in a 1-hour time frame. You're really going to be working through these steps in an iterative process over time. Everything your team puts into the tool is saved and can be downloaded back out of the tool as what we call the D4DS action plan. And that comes out specific to your project. So the action items your team is working through are first, you're going to identify who are the key partners of your project. So this uses that 7 Ps framework I presented earlier. It gets you thinking about who are the different partners in those 7 Ps, and then who are the most important for your team to engage. And then you can actually invite those partners right there in the tool to collaborate with you. The second one is empathize and outline your problem. So we as researchers, we often come into a project thinking we know what the problem is, but really we need to ask our partners what the problem is to them. We need to understand their needs so that your product can't have demand and value. It walks you through this process, and then you actually develop a value proposition for your product. Third, you're understanding the context. So we walk you through an activity to think through the context in which you will use your product. Then we're thinking about confirming and co-designing your product, selecting co-design methods to develop your product. You go through an activity developing a dissemination plan and a sustainability plan, and then we have an evaluation component. So let me see if this is going to work. This is just what an action item looks like. So each action item has kind of an about it and then an interactive component where you save answers and then generally generate some sort of product. At the bottom of each action item is this dive deeper section, and that's where we give you key resources to support you with that specific activity. You'll also see, and I think I'm going to present on it. Yeah, the cue to equity part. So at each action item, we cue your team to something you should be thinking about to complete this activity using kind of equity principles. So it's really prompting users to think about how you would perform that action item with equity intention. So this could be considering who is present and perhaps who is not present from your research team. You might be thinking about how should you be asking your community partners questions and thinking about issues of power or implicit and explicit assumptions of your questions. Thinking about ways to share information that reflect the values and cultures of your partners. These are just some examples of the things we're kind of cueing people to. And then we have additional resources where we link out to, if you want to do a deeper dive in thinking about equity, these are some of the things we recommend. I'll pause here. I'm happy to hear kind of what excites you or what scares you about this tool. Also happy to hear that as well. And then who do you think would benefit most from a tool like this? So I'll invite people to come off mute or chat with me.
Yeah, I was gonna say taking the question in the chat might be interesting.
Is this from Alexandra? I would love to adopt this format to an SDOH program design framework. I hope to train people to use. Did you use an instructional designer to develop this toolkit? Not sure what you mean by instructional designer. A company, HICAPS, designed this tool. So it's a professional company, that we partnered with to develop it.
Could you put the name of the company in the chat?
Yeah, they are based out of Chile. They developed 3 tools for me, and I will sing their praises for sure. They're great. They're specifically great, and this is not a good example, but if you're developing a tool for clinical care settings, the founder of this company was an old clinician who retired and just wanted to start creating digital health tools. So he has a really nice understanding of clinical settings.
That's what I would be using it for.
Yeah, so something that related to your second point, something that came to mind about this tool and like the potential investigators who might be using this tool. I've been reviewing for PCORI recently, and PCORI I would feel like I would have a vested interest in having their investigators use this tool, thinking about engaging stakeholders is the term they use. I know that you have not been using that deliberately, but engaging stakeholders in the design and the demand for the product or the intervention, and then stakeholders throughout the life cycle of the project, and then sort of in the dissemination of the results. And so it made me think that PCORI and the investigators with PCORI would benefit a lot from using the tool. And so related to that, my specific question is, how much engagement have you had with them, or kind of anyone related to using this potential tool for PCORI related projects?
None. So great suggestion. Would love any tips on how to connect with them. One thing we are looking to do, and I think I'm going to mention this later on, but we're hoping to do some kind of case studies of teams using this tool. So if we could find a team who has a PCORI grant in the early phases who would be interested in using the tool, we really want to kind of do some either facilitated use or just understand how they use it and generate case studies that then we put back on the tool that we're going to call D4DS Planner in Practice. So we're hoping to learn from early users at this point.
My other question was a bit related to, this is, I think this is ideal for early stage projects, particularly in the proposal stage and even in the early funded stage. But I think there's probably a lot more mature projects, just thinking about the prevalence of projects that are a little bit further down the line, and was curious if you could talk a little bit more about what features or pieces kind of more mature projects would use from the tool specifically.
I think you would probably jump in at the dissemination and sustainability planning phase. So even though those are planning components, I still think if you have a project that's mature, you might want to think about who to engage. You want to engage your partners in the development of those two components. Particularly the sustainability portion is not often thought about. And so it takes you through a process where you're engaging your partners to think about what are the areas in which you have capacity or could build capacity to sustain this, and how are you going to do that? So you plan with them how you would actually do that. I think I've actually gone through this process with a group of community-based organizations for a specific project, and having those conversations is amazing. Just kind of what you learn. But I think those are the two steps I'd recommend for a more mature project. Well, I'll move us on. I know we only have 20 minutes. And I think my next thing is just to give you a quick kind of a little bit more about what each of these steps looks like with a case example. So I'm going to take you through a few of them to give you a little more detail. So this is the identify partner step. And like I said, this is based on the 7 Ps framework. So your team is actually brainstorming potential partners. You click that add button. You can add different partners in the different categories. So everything's color coded. And then your team can actually vote. So you see these thumbs up little icons. So you guys could vote in real time, or your team could go in whenever they want and vote who they think is the most important to engage in this process, or engage more broadly. You may want to be doing like a whole CVPR approach beyond just this D4DS process. And then you move them into the selected partners. You can see there's email addresses. So you can actually send an invitation to that partner to be a team member in the tool in your project. And so that's how you do that there. You'll also notice kind of at the top, there's a timeline, there's a lock feature, and then there's this little people feature. That's how you assign tasks. As the lead of a project, you could lock it and say, we're done with this activity. I don't want anything else to change. You could set timelines for completion for your team. So there's kind of functions there for collaboration. So now this is the empathize and outline your problem. This is where you can actually engage your partners. You can send them a survey. It's an open-ended survey, kind of asking them about the problem and what the problem is to them. What are their challenges they face in solving this problem? What would help them overcome it? Or you could do it more of like an interview where you could just answer it and fill in the survey as they're talking to you. You can amend the survey as well. So we recommend some questions based on the customer discovery methodology, but you can change your questions if you want it in the tool. So you send the questionnaire off. The tool uses natural language processing to then analyze those responses for you. So you click, there's no answers yet, but there would be a blue button down here that says analyze partner responses. You do that and it generates themes for you based on what they said. So then oh, I have a picture. There's the questionnaire. Didn't realize that. It creates the themes for you, and then it kind of, you bucket them into these three categories: problems, the goals, and the barrier. And so then you think about what are the most important things you're going to try to solve with your product. What is the problem you're going to address? What's the goal of your product? And what barriers is it going to overcome? And once you select those, it generates a value proposition for you, which might read something like this, but you can, of course, amend that as well. You're probably going to want to amend it. It's not perfect, the natural language processing, that's what we learned, but it certainly makes it a lot faster. So everything is you can edit, but it does try to generate it for you using AI. So a value proposition really kind of, it tells you what your product is going to address, what barriers it's going to overcome, and what's it going to help people with. And then it tries to also say what's the value add compared to what's already out in the market. So this might look like our digital health platform helps healthcare professionals who want to provide personalized counseling and motivate patients by addressing lack of information and enabling effective follow-up. This digital health platform is innovative because it adds the delivery of community resources into health behavior counseling. So that's that. So this is the confirm and co-design your product step. In this step, we're really asking you to think about what are the co-design methods you might use, or select co-design methods you might use to develop your product. So in this example, it was a technology. And so we recommend 3 methods: human-centered design, design thinking, and the double diamond design approach. If you selected human-centered design, it then walks you through thinking about a plan for how you're going to do that. So again, this is very much a planning tool. It's not going to help you do human-centered design. It's going to have your team come think about a plan for how you would do it. Dissemination planning, similar thing. So you would first start with your team by brainstorming all the different products, dissemination products that you may use. So you first enter in your target audience. The tool, your first step is entering your target audience, and then the tool actually recommends dissemination methods that reach that audience. You can add other methods if you'd like. This is just based on the literature, kind of which ones we know those audiences access the most or receive information from. So then you select all the different ways you may reach that audience and you create those. Then your team kind of prioritizes which ones are the most important. I guess I should say important and feasible. So we have you kind of rank them both on impact and feasibility. Of course, we want to usually do all of them, but that's not reasonable. And so your team votes for both of those, and then you select products you're going to move into the dissemination plan. Once you move a product into that yes box, it has you go through a plan of how you're going to generate that. So who's going to generate your product? When are they going to do it? How much money do you need to do it? There's a number of questions your team has to complete to really make it an action plan of how you're going to achieve your dissemination. Here's kind of my tips, but I think I've given you a number of them already. I would really familiarize yourself with the tool before you engage community partners. This is a pretty like intense tool. And so engaging them meaningfully is going to be important. You don't have to engage them in each step, although I think in some ways that's kind of nice to have the comprehensive approach, but they, may not have the capacity to do every single thing. So maybe you just want to use them or engage them in one or two or three of the components. It is meant to be collaborative. So it is built to be a team-based approach, and it's meant to be iterative. So we recommend giving yourself time to use it. Like I said, it's not meant to just sit down for 1 hour and finish the whole process. It's really should be over time. So just a couple other discussion questions for you. How do you see this tool being used in your work? And then what are some challenges you may face in using this with community partners? I think would be of interest. I'll kind of just wrap before I open it up for those questions. I said this already. We are just disseminating this tool now. We are trying to learn from early adopters of the tool, how this really works in real world practice and in collaboration with community partners. So I'll be really upfront. We did not engage community partners in the development process. We only engaged practitioners and researchers. So we know, it was developed from that perspective, and we really need to learn what works for community partners and what doesn't. And then if we want to do some sort of pragmatic trial to really understand, do we need to have an implementation strategy of facilitated use versus teams who could just pick this up and use it independently? Does that make a difference? So those are just some things we're thinking about doing in the future. Yeah, I'll open it up. That's the end of my presentation.
That was wonderful. That is a really cool tool. Actually, I'm just like sitting here thinking of how much work went into it, and even like the NLP behind the scenes and things like that. You should be like, this is pretty cool. I see that Nancy had a question in the chat. I don't know if you want to come off mute and explain it, or if you want to just
Sure, yeah, I'm happy to. Mara, thank you so much. This is super interesting, and it was very interesting to see the use of some of the generative AI stuff in it. We've been thinking a lot about how to use that, and I was just wondering, so I was testing out some other tools that were for basically, we do a lot of pragmatic trials, and the reporting of those is relatively standardized, and we have to follow the consort guidelines. And so having some sort of a guidance is really helpful. And there are a couple tools out there where you can kind of input that basic information and it spits out for you basically an outline of a paper, but not quite like written appropriately. And acknowledging all of the considerations of appropriate citation and how to appropriately incorporate generative AI tools in scientific writing. Would you ever consider that as part of this tool? Because so much of the information about your product goes in your planning process and interacting with this tool. And I could imagine it could actually generate a pretty good summary of what the team did and what the process was and what the product is, that could help with writing papers and dissemination.
Yeah, really great question, and like not something I've fully thought about. So you're thinking like citing the tool or citing like the AI that's used within the tool, like if you pulled out the value proposition, for example, and put it in a paper.
Yeah, so and I'm not super up to date on all of the different things, but basically in most of the journals when you submit to a journal, although I don't think there's anything like this for submission of grants yet, but there probably would be my guess in the future. You basically have to acknowledge whether there was a generative AI tool used, and it should not be an author. After one paper like made it the tool an author on the paper, and then that got rescinded. So basically, there are various guidelines about how to appropriately cite that. But I guess I was just wondering, the value proposition is already something that comes out of the AI in this, but I could imagine it could do even more. by summarizing all the other ways that your team is interacting with it. So just curious about that.
Yeah, it's a great question. Something we should probably think a little bit more about. Yeah, I think I didn't think about it necessarily in the same way as like for the journal when you're using generative AI to like create your manuscript outline or write part of your manuscript or whatever. Because it is writing the value proposition, but not I mean, it's using partner responses and plugging it into basically a formula. So it's a little different, I think, than like actually writing part of the paper. But I think it is something to think about more broadly about what the tool generates. So I appreciate that comment. I don't have a good response.
There's a question in the chat, I think more about overview of citations for evidence-based interventions, outreach dissemination strategies based on audience types.
Yeah, if you go to the Education Hub and you search and you filter for dissemination, you're going to see most of those papers listed in there. There's not a lot of evidence out there for how we reach certain populations, but there are a few good papers, one of which just came out by one of my colleagues, Timmy Chateau, about how practitioners access information. I know Ross Brownson, who's one of the collaborators on this tool, has published a few papers in that area. We need more, to tell you, but what we have is in the Education Hub if you filter for dissemination. Not sure if that answered your question. If it didn't, please feel free to come off mute. Well, good.
Can you talk a little bit more? I know I appreciate your kind of recognizing like where the development of this came from in the first place. And I'm thinking of your second question about like the barriers to getting community partners to using this. I was thinking a little bit about like how you kind of have it set up almost to deliver a survey or receive information back from community partners. I don't think it's intended to be in a way that's like generalizable and would have to go through the IRB in terms of collecting that information. But I'm curious the extent to which you've kind of used it so far with community partners and sort of what experiences you've had so far using it in that way.
Yeah, we have not used the tool with community partners. I have done a customer discovery process like we do in the tool with community partners as part of another project. I think in terms of IRB, it depends on how you want to use it. If you want to publish on those, and of course you need the IRB. If you're just using it for internal purposes to generate an idea for a product, and then you're not going to do anything else with it. But there's a couple really nice papers on customer discovery. Those are also in the Education Hub, one by Elaine Morato, one by myself, on using that methodology to think about generating value and what a product with value. But yeah, we haven't used the tool with community partners yet. So that's definitely a gap and somewhere we want to go.
Colleen, did you want to ask your question?
Sure. Thanks, Maura. And I was the one who asked about the overview of citations. This is terrific. I'm wondering, is there any intention for, and I'm sorry, I logged on a little late if you already said this, but is there any intention for government groups to use this? So I work at NIH and I'm thinking about a few potential ways that it could be used here. And then I'm also thinking about the OMB clearance process and if this could be included as a potential like questionnaire tool with external groups or not. So I'm just curious if that's come up at all. Thanks.
I'd love to chat with you more about that. I've had one conversation with April O at NCI, who was at a recent training where I presented on this tool about that. But nothing has like formally been decided. So it was just kind of like our very first conversation, but I would love to hear more about your ideas. I think I need to learn from you on how that would work.
Sure, that would be great.
Great. And I think maybe we have time for one more question. I don't know if Jamie or Jaime, sorry, if you wanted to ask your question about learning collaboratives, or maybe it was just more of a comment that maybe would be benefit from expanding upon if you are able.
Sure. Yeah, it's Jamie.
Jamie.
I'm with Academy Health, and we run a lot of learning collaboratives where we have grantees who are implementing usually D&I research projects, quality improvement projects within a university medical setting, and thinking through how we might utilize this tool with a group of like 5 to 20 of these grantees. And this could be a really nice way for them to come with some like pre-work having been done, so that they can then share sort of lessons learned or challenges. Or I'm kind of thinking like this is a nice way to see like more like apples to apples, how they might share across projects, but curious if you had used this tool at all in that capacity before.
No, my answer just is the same. This tool was just launched at the annual DNI conference, so in December. So we really haven't used it at all yet. We're trying to learn. So I love that idea. And this is, every time I present, I hear more different ways that it could be used. And that's what's exciting to me right now. So if you ever do use it in that capacity, I'd love to hear from you how it went. I think also at this early stage, I'll say we're kind of happy to help a little bit and facilitate use. If you want one of our team to come in and really like facilitate a part of the tool or something like that, we're also willing to do that. Yeah,
Awesome.
I love that idea.
No, that's great. And we might take you up on that. So thank you.
Great. Well, this has been really helpful. Sounds like we're getting to like the second stage of disseminating the dissemination tool.
Yeah.
It's very if we put Dr. Kepper's email in the chat, if you have questions, it sounds like she's a great resource to reach out to, and it sounds like cool connections have been made today anyway. But I really want to say thank you for coming here today and talking about your tool. And if you have any other thoughts or last kind of comments, otherwise, we've included the planner. Thank you for that, and your email. And thank you so much for coming.
Yeah. You can also just hit contact us in the tool. It goes to me. So either way, you can use my email directly or via the tool.
Beautiful. All right. And then, next month we have someone else coming in talking about step wedge. So it should be fun. Thank you, everyone.
Thank you.